Yes, I'm Robin Riley. I have just retired after 43 years as a special education teacher, and before that I was, a terrible term now but it was appropriate then, I was a mental retardation nurse at both Stockton and Marsden hospitals.
How can elderly and developmentally delayed children benefit each other?
I think with this plan, where you have two groups who are probably used to being the centre of attention, each interrelating, and they'll have to adapt to those skills of, well, she doesn't want to do that right now, and it doesn't matter how much I want to. But if a child with a disability is constantly in a caring type association or relationship, then they always, well, 99% of the time, they get to call the shots.
Yeah.
And that's not natural. It's very lovely, but it isn't social inclusion.
Yeah.
How are the families of the developmentally delayed children affected socio-economically?
Their ability to work or to accept higher positions in a company is limited by the fact that they need to be available for their children for a longer period.
What is the stigma in society around the care of these two groups?
It's expecting people with disabilities to rely on charity, and that's not always a good thing either, because people are very well-meaning, but they're patronising.
Mm.
One of the social determinants of health is addiction. How is this combated with the developmentally delayed?
For a lot of parents who have a child with a disability, they tend to keep them away from any sort of undesirable influence. But
so that's so the biggest deterrent is just keeping them away from it.
Yeah. Mum and dad are there.
Yeah.
I mean, that's why you have so many people with developmental delays who never go out anywhere, and so they tend to be cocooned a bit.
So again, we're coming back to that social exclusion.
Yeah.
How does this cocooning affect their education?
And there's a lack of knowledge.
Yeah.
I've had some incredible reactions over the years from parents because I want to teach their children about sexual health. I want to teach them about personal development. Don't tell them about that.
Yeah.
We haven't told them. But they're the very children who can be exploited to be delayed.
How are the demonstrations of stress perceived by society?
There's intrinsic stress just from not knowing the situation or not knowing what's going to happen or not understanding what's happening around you. The world can be a very cruel place for a person with a disability.
Mm.
But we, in this attempt to normalise kids, we try and eradicate all these socially unacceptable behaviours. But, you know, people will say when I'm stressed, I talk faster and I move faster, and they're visible manifestations of my stress. So that's socially acceptable. So why is the thumb biting or the rocking not socially acceptable?
Mm.
Why can't people who don't have a disability be taught that that means he's stressed or that means she's feeling uncomfortable?
All right.
Is further education of the community necessary in understanding these groups?
I've just been reading a book about the very early days in the Sydney colony, and the way that the settlers reacted to the Indigenous community. And, you know, we gave them a hut, and we gave them a plot of land, and we gave them tools, and we gave them all this, and they just sat there and didn't use them. They can't, you know, they're not civilised people. Well, I'm sorry, but just because they didn't do it your way doesn't mean they didn't have a way of their own. Employees,
Building healthy public policy, how can we support the employment of marginalised groups?
Additional aids or additional changes to the work practice.
Yeah, right.
If you really accept a person with a disability and you totally include them, then you will do everything you possibly can to allow them to function at the highest level they can.
So what you're saying is, if that employer has a perception that may not be educated about how much management that disabled person is going to require.
Yes.
So by exposing that employer to, individuals with disabilities,
Yeah.
they might have a better understanding of what would be involved in hiring them.
Yeah.
So what's the main strength of Helping Hands?
If something is mutually beneficial, then it is more sustainable than if it's one group giving to another group.
I'm Julia Poole. I'm what's called the clinical nurse consultant for aged care for Royal North Shore and Ryde, which means I cover 2 acute hospitals and the community.
What are some of the positive influences somebody with so much life experience can give?
There's some wonderful literature about the positive nature of having more older people in society. Yep. Now this is what's going to happen. There's going to be so many of us retired, healthy, cashed up, with time on our hands. You look at the people that volunteered to help set up this new hospital here. We had an immense army of older people who gave all of their time to help us set up, and they're still there. You look at the Red Cross, you look at churches, you look at Rotary, all of these things. This is older people, healthy, still with good brains, managing to prop up society.
Would an active lifestyle and participating in low intensity sports, would that be beneficial in a healthy ageing process?
Absolutely. Exercise is the be all and end all. We know that. It's the major factor in bodily health, but particularly in cognitive health.
Helping Hands is an example of a health promotion project self-supported by its members to improve the 10 social determinants of health. As we have heard from our community experts, Helping Hands will have a positive flowing effect throughout not only the marginalised older generation and developmentally delayed children, but also their carers and employers. Helping Hands also contributes to trend the social stigma of the Australian public into a more enlightened and inclusive position on these marginalised groups. Make your hand a helping hand.